Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from the administrative offices, and our special guest is Christine Powell, BSN RN with Aultman Birth Center. Good morning and welcome to the show, Christine.
Good morning. Thank you for having me.
All right, today we're going to be discussing pregnancy health and newborn health and safety. We'd like to remind our listeners our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program. Welcome to the program. Why don't you tell us about yourself and your career with Aultman?
Sure, I'd be happy to. I'm going on next year. 2025 will be my 30th year with Aultman. So
Wow.
I sometimes feel like I don't know how it happened, and other times I feel like very much like I've been here 30 years. But
But you only
I
look
have
29.
Oh, thanks. I appreciate that. Again and again, 29 every year. But I started right out of nursing school. I actually went to Aultman Nursing School when it was a traditional kind of old-fashioned nursing school. So
Hmm.
very well trained clinically, lots of on hands, hands-on patient care. But I started right out of college in OB. And I have never left. So it is
Hmm.
my place. It's my happy place. Sometimes my sad place. But
Hmm.
there's nothing that I would rather do than be right here. So when I started, I did bedside care, nursery, mom, baby care. And then I very shortly after started teaching. And I taught childbirth classes for families expecting. I taught babysitting classes in the community. Then we developed an inpatient program for education to teach new families before they go home. Since then, I've been very active in community outreach for us, especially when it comes to mom and baby information locally here in Stark County, and trying to educate and advocate for people in our community. And then I also work for the bereavement program here in the hospital as well. So I am all mom and baby. If you've got questions about other things, I'm not your person for sure.
Okay. So, what is the first step in keeping infants safe?
So we would like to see all of our families that have a baby really think about uh, well-being, safety, health before they actually conceive. So pre-pregnancy or preconceptual care is ideal. And we know it's not always a reality because there's a lot of surprise babies that show up in our world. But preconception care can address things like if you have pre-existing conditions, for example, if you are a diabetic, making sure that you are all regulated and well controlled before conceiving, because that's just going to start you on a better path, and keep you healthier and your baby healthier throughout pregnancy. Same thing if you have chronic hypertension, that's something that we want to make sure that's managed and well controlled before we introduce a whole nother life that your body has to take care of. So most of and there's not just things we have to manage that way, but also your social habits, lifestyle changes, if you're a smoker, if you have some drinking habits, things like that, all need to be taken care of before we start with a pregnancy. So also on the opposite end of that, when you know you're preparing, you could start a regimen of folic acid. That's something that's been very well known to reduce birth defects. So just being proactive, being very involved in your health and well-being before we start with pregnancy. So we'd like to say it starts even before the baby is conceived.
Set yourself up for success is what you're talking
Right.
about.
For sure.
Excellent.
For sure.
So maybe you've already covered a little bit of that. When should prenatal care start?
Well, so a little difference. Preconception, what I was just talking about, you could make an appointment with a physician before you actually know that you're pregnant to discuss if you have health concerns or things like that. Prenatal care itself would start most of the time for families after they have a positive home pregnancy test. And once they have that positive home pregnancy test, then you need to call a physician, get in and start getting some appointments made. Most families, most women can expect between 10 to 15 give or take, prenatal appointments throughout your pregnancy. They start off kind of sparse, once a month until you're farther along in your pregnancy, and then the program, your schedule increases as you progress along.
Okay.
Mm-hmm.
Why don't you talk about why that's so important?
Mm-hmm.
And I only bring that up because we have patients that roll in the pharmacy all the time and they don't even have a primary care doctor. They use the urgent cares or they do things. And I think we're talking about being a lot more proactive for the care of a prenatal child.
Sure, a pregnancy and an infant for sure. So prenatal care, the visits themselves, it gives your physicians opportunities to always be looking at your baselines and at your prenatal visits. They do blood pressure checks, weight checks, they do urine testing. All these things can be indicators of something that maybe isn't going well. And most of your physicians, I would like to probably say all, would rather be proactive in treating something than trying to fix it after we've already developed a full problem, and so prenatal care itself, there's a lot of research that shows that those who do not receive prenatal care, their babies are 3 times more likely to be born with low birth weights. They are 5 times more likely to not survive. So those are significant numbers, very indicative of what lack of care, the consequences of lack of care, and what that can be. So it's important, and we see it. We have a lot of families who don't know they're pregnant. So sometimes their prenatal care starts late, and that's all accidental. But when you're aware, you have to get in there and get those appointments and be seen by your care providers.
What conditions can be detected during these visits, and how does it affect pregnancy outcomes?
So as I mentioned, they do your blood pressure, they do, urine testing. So conditions, again, back to our most common, we'll just kind of refer to those, are gestational diabetes. So that's a diabetes that occurs because of pregnancy. And that is often found. We have blood sugar testing that we do during pregnancy. Your body just, it's doing a lot of work. So sometimes it can't keep up and things go wrong. And that's where that testing and that care gets that early intervention. Same thing with the hypertension, or we have a condition called preeclampsia, if you've heard that term before. So preeclampsia is the symptoms of that. It develops only during pregnancy. Symptoms include usually high blood pressure, some fluid retention, some spilling of protein into the urine. Those are all things, again, that you're going to find at your physician appointments. So if we're not getting there, then we're not getting those seen. So untreated, any of those things untreated are going to lead to complications for both mom and baby, and they can be pretty serious. So our untreated gestational diabetic moms often have very large babies that kind of makes that dangerous for them for delivery. Also, then babies have a hard time regulating their blood sugar a little bit after delivery. Our preeclamptic moms, if that goes untreated and unrecognized, we're worried about seizures. It can get really dangerous for both mom and baby.
Wow. So, Christine, what role does mental health play in pregnancy?
Mental health, the good news is mental health has been much more prevalent, paying attention to it and being concerned about it. So you probably know in your field too, there are a lot of people that are being treated for mental health conditions. So most commonly anxiety and depression. The first step we need to do is, if we're on a treatment plan with medications and all of that, to make sure those are safe to be used during pregnancy. And if they are not, then we need to come up with an alternative treatment plan. And that can be difficult for moms that are, pregnancy is, if you don't have mental health conditions, it can produce anxiety and depression itself. So if you have those conditions already, we need to be extra cautious that we're paying attention to how mom is feeling psychologically, mentally, and getting a new treatment plan, making sure that everyone is on a good path before baby arrives.
Okay, I guess our first break is here already. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by our pharmacy and talk to a pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. So Christine, what role, um, what role does mental health play after pregnancy and infant care? I mean, I know that is a complete changeover in a family and in a woman and a family's life.
For sure. And just like we were talking before about mental health during pregnancy, that doesn't just disappear after the baby is born, right? So if there are any previous conditions, anxiety, depression, and then now you have a whole new life that you're responsible for. So that can contribute and kind of intensify those situations. But even if there isn't underlying mental health concerns,
Mm.
most moms experience a little period of time after delivery, what we call baby blues or postpartum blues. And so that is a pretty standard thing across the board for all new moms. A lot of it, we can't solely blame one thing or the other, but there are a lot of hormonal changes that happen just physiologically for a mom after delivery. So we're going from pregnancy hormones to post body hormones where you're trying to get back to what you were pre-pregnancy. And so that can wreak a little havoc on us. And usually you're physically exhausted, emotionally exhausted from the whole birth experience itself. So postpartum blues, baby blues are pretty mild. We just find ourselves weepy most of the time, a little tearful.
Mm.
Somebody says what's wrong, you have nothing that
Mm.
you can verbalize is wrong, and well, then why are you crying? I don't know. You just are.
Mm.
So that's all very normal. It's a period of time. Usually it can start initially even in the hospital as soon as the day or two after your baby's born and last about 2 weeks.
Mm.
So in that time frame, we just encourage and our families, first of all, educating them that this is normal. It's an expectation. So don't feel like something is wrong with you. This is kind of just something you're going to go through. But asking for help and support from your friends, your family members, making sure you have the opportunity to rest when it's available. If baby is calm and quiet,
Mm.
take a minute or two to take care of yourself, stay hydrated, eat well, continue taking those prenatal vitamins,
Mhm.
just to make sure you're doing everything you can, just like we said earlier, to stay on a good path.
So how does someone know if they're experiencing postpartum blues, depression, psychosis?
So all very different things. So the blues, like I mentioned, pretty common. Almost everyone experiences that. Postpartum depression, we get concerned about that when those symptoms last a little longer than 2 weeks or they appear much later. So true postpartum depression can happen anytime from birth until a year after pregnancy. And so that initial weepiness or fatigue or maybe becoming easily agitated, those things just don't seem to let up. They don't seem to go away. And then other factors come into that. So we tell our moms and our family members that are supportive around mom, pay attention to how she's feeling, how she's showing symptoms. If people are saying to you, this isn't like you don't seem like you set yourself, are you sure you're okay? Those are kind of your clues that you need to take a minute and see how you really are adjusting and coping to having a new baby. Postpartum psychosis is extremely rare. And usually that has it comes with a very complex mental health history. It doesn't just develop out of anywhere. But in any circumstance like this, we have to pay attention to it because now we have a new baby, another life that we are completely responsible for. That baby is unable to take care of itself. So if we're struggling, we're not going to provide the best care for that baby. So
Hmm. Interesting.
All right. So, what do we do if you or someone you know is experiencing these symptoms?
That's a great question. So addressing the issue first and having that honest conversation, like how are we doing? Are we functioning? Are we coping? Are we caring for baby? Are we caring for mom? If you have a previous counselor, someone, that's a great idea to stay in touch with them. Keep your program as scheduled, your treatment plan as you have it. If you have not had any mental health care before, your OBGYN, whoever your physician was that delivered your baby, is a great resource for help. So you always follow up at 6 weeks after you have a baby. So they're going to check in with you at that point and they're going to say, how are you feeling? How are things going? And sometimes at 6 weeks, you still don't really know how things are going, especially if you're a brand
Mm.
new parent. We're like, I don't know. Sometimes it's great and sometimes it's not. And that's just life with children, right? So you have those conversations, but if you're feeling like you just can't get over that hump, you're just not doing as well as you'd like to, call your OB, have the honest conversation, say, I'm not sure I'm doing so well. I think I need some help. Also,
Mm.
same with your support people around. If they're recognizing that, don't be afraid, because we're looking at taking care of the baby, like I said. And if we're not able to care for ourselves, we're going to really struggle taking care of a newborn that needs our attention.
Mm. Mm.
Do you have
Yeah.
anything else you want to add about the safety of a newborn with relation to postpartum blues or depression?
Sure. I would say I would encourage everyone, to just, again, pay attention to how you're feeling, and be honest about those feelings. But if at any time you feel, um, have feelings of harming yourself, harming someone else or your baby,
Mm.
those are emergency type situations. That's not something to be ignored. That is an ER visit. That's a crisis hotline call.
Mm.
Those numbers are available. There are people that assist with it, and it happens. Like, don't ever think you're the only one it's happening to, or that you're alone. There are a lot of people out there to help you. So again, this is prevention as well as it is, we don't want something terrible to happen. So getting that help and making that call
Mm.
is essential for everybody's safety.
I
Gosh.
think that applies too in a lot of different areas of life. I mean, I think we're all brought up to believe we're tough, you can make it, you don't need help. But you know what? That's all a bunch of garbage. There's
Mhm.
nothing wrong with talking to people that have had the experience you've already had, or had a situation where maybe they can provide a little bit of peace or solace and help you navigate through it. So, like
Yes.
you said, other people have
Mm.
experienced it too. So
Right.
don't discount the fact that you think there's something wrong with you.
Right. Right.
Mm.
All right.
Wow.
The next question I don't like to talk about, but we have to talk about it. Let's talk about shaken baby syndrome.
So it kind of, we kind of lead into that, because this is something too that, you know, like you say, we don't like to talk about it, but we have to, because it's a real thing. It happens. And some of the misconception I think out there is that that'll never happen to me. I could never shake a baby. I can't believe that somebody could shake a baby.
Mm.
Or you think it happens in uneducated areas or families with substance use problems, or things like that. And the truth is, it happens to average everyday people, because a
Mm.
new baby is hard. Having a new baby is hard, and they cry. In the
Mm.
hospital, they're perfect. They're these sweet little bundles of joy, and you're so excited. And you're like, I hear it all the time. My baby's so good. They're so good. They barely cried.
Mm.
And I'm like, that's great, but it's coming, right? It is going to happen.
Mm.
There's very few babies that don't have a little spurt that they
Mm.
go through. So crying peaks usually between 2 and 4 months, and we have to recognize that it's a communication tool. Babies don't have words, and so they're using crying to communicate. So
Mm.
in the case, shaken baby, to define it for you, is um, it's also called traumatic brain injury. So it occurs when someone violently shakes a baby. So we get a lot of questions too about rocking or bouncing. Like when you're soothing your baby and you're bouncing and you're rocking, like, is that too much? And we're
Mm.
talking about a harsh, abrupt shake. So all the research says that it typically occurs when a baby is crying and won't stop. And so
Mm.
whoever is taking care of the baby becomes
Mm.
frustrated, agitated. All those feelings are normal, by the way. If your baby's crying for
Mhm.
hours at a time, you're going to be tired. You're going to be
Mm.
probably a little frustrated. It's what we do with those feelings that's important.
So, what can be done to prevent shaken baby syndrome?
So I think the first step is educating. Like I said, we do a lot of education here in the hospital, and just telling parents, expect a bad day at some point. Expect that you're going to be tired and your baby's going to cry and you're going to be frustrated. But in order to prevent it, we need to just explain how to handle a baby that's fussy. That we first try our physical needs. We feed them, we change them, we burp them. Take a look at a baby, see if there's anything going on, a rash, some lumps or bumps, their skin seems red, they seem
Mm.
warm, something physically that's going on. If none of those seem to be the problem, then you have to try all your tricks. And your tricks you're going to learn those, and those are going to change
Mhm.
over time. So you're bouncing, your baby swings, you're shushing, background music, calming, soothing sounds, all those things. But if nothing works, we need to know when it's time to give ourselves a break. And at that point, we want to tell parents it is completely okay. It's acceptable to put your baby in the crib and let them cry by themselves. You can't shake a baby you're not holding. So you've completely removed that off the table.
Well, it isn't always the parent that shakes a baby, is it?
No, sir. No, sir. It is. That's another important fact about looking for care providers, whether it is a daycare scenario or anyone that is going to take care of your baby. Make sure that you're trusting them to know that they can handle that bad day, or that they'll call you, and say, hey, your baby's really fussy today, and we need you to come pick them up, or we need help. So
Okay, it's time for the news.
Mhm.
It is the bottom of the hour. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Yes, you are listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking to Christine Powell. So, Christine, I hear this in the drugstore every once in a while. The kid will not sleep, and or he won't sleep, or she won't sleep. So, how should a newborn sleep when they come home from the hospital?
Well, that's great. It's hopefully well and for lots of periods of time, right? That's how we want them to sleep. Unfortunately, that's the ideal thing that we think might happen. Again, babies do this in the hospital. They're so quiet and peaceful and sweet. And then you get home and you're like, what happened to this sweet little baby? So we focus a lot of education on safe sleep here in the hospital. And we do that because there's a high rate of sleep related issues in our county, and safety and suffocation and things like that. So we educate our parents. We use ABC. The ABCs of safe sleep is what we focus on. So just to go over those quickly with you, A is for alone, B is for back, and C is for crib. So when we say baby should be alone in their crib, we mean it completely by themselves. There is nothing to be in that crib with them. No pillows, no blankets. Bumper pads have finally been outlawed. They're not on the shelves anymore, so that's a good thing. No bumper pads in the cribs. No stuffed animals, toys, blankets, any of those things. So as far as placement, they should be on their backs. And we can get into that a little bit further here later, but always on their backs for any time that they are sleeping. And then the C for crib, when we say crib, we mean a safe, firm sleep surface, something that is designed for sleep. So that could include a pack and play, a bassinet, a cradle, or a crib itself. So those are our surfaces that our baby should be sleeping on.
What should a newborn be wearing while sleeping?
That's a great question too. So we encourage our families to start with less, to be honest. And sometimes we have these conversations with parents, but I'm going to just share that we have to educate our grandparents as well, our caretakers. And I kind of joke a lot about my own mother with my children, and they were always cold, she would say. And they're grown adults. And she'd say, I think I'm worried about them being cold. I'm like, they're fine, Mom. But always wanting to overdress. It's just something we want. We want everybody to be warm and cozy. So a new baby coming home should be sleeping in a t-shirt or onesie, even with a sleep sack or a wearable blanket, we call them. If you don't have that, a one-piece sleep outfit, something lightweight with a t-shirt or onesie underneath. Now, this should be adjusted based on your home environment as well. So if you have, for example, an upstairs sleeping area that you're using, bedrooms that's warm, because it's the upstairs and it's hot and you don't have air conditioning, you can even go less. Your baby can sleep in just a onesie and a diaper. Same with the opposite. As we approach these warm or these cold, I'm confused about Ohio weather, cooler months coming up, and your windows are drafty or something like that. Then you adjust accordingly. But we always start with just that underlayer, one piece over top. Home temperature, we recommend about 68 to 72 degrees. That's the comfort level for everyone in the safe zone for a new baby at home. If you get up to feed a baby, their feet feel chilly, their hands feel a little chilly, then you can address that, put some socks on if necessary. But we always want to start with less. when we're putting our babies to sleep.
So moral of the story, no blankets in the crib.
Correct. Nothing in the store, nothing in the crib. But it's such a hard, you're used. Well, first of all, you get all these beautiful, pretty blankets that have the baby's name on them and all this great stuff, and you want to use it.
Yeah.
But they are to be used while your baby is awake and supervised. So blankets can very easily come up around their face, get in their area where they're breathing, and just obstruct that airway. So it's a big safety concern. And a new baby doesn't have the ability to pull that away, and get that out of their breathing area.
How about is this a time to touch on being extremely careful? How do you address parents that want to have the baby in their bed with them when they sleep?
That's a good way to word the question. Co-sleeping is what we refer to it as. We do not recommend co-sleeping in any circumstance. We're adamantly against it. The American Academy of Pediatrics we follow the guidelines of what their recommendations are, and it is not recommended to co-sleep. So that being said, we know everybody is tired, and this is a subject we just had a dinner last night with another speaker from out of town, and just acknowledging the straight fatigue that new families feel, and how easy it is sometimes to just fall asleep with your baby in your bed. And so it's dangerous. It's dangerous because you're tired and you don't think you would fall asleep on your baby. You think you would feel them if you happen to roll on them, and that's not the case. And it's a sad, tragic event when it happens. So we just want to avoid that at all costs. What you should be doing is sharing your room, but not your bed. And by that, we mean if you've got that pack and play or that bassinet, that you should have it in your room with you to make for easy transitions. If a baby wakes up, you can soothe them, put them back to sleep, or wakes up for a feeding, feed them and put them back in their own sleep environment. And it's easier done when they're in your room with you.
So what about, I saw a billboard driving down the street the other day. Babies safer on their backs than their stomachs?
Yes, absolutely safer on their back. And again, this is a thing that we see over time. Things change, and I hear it a lot when I'm doing community things where grandparents say, well, I put my baby on their belly and they did just fine. They turned out okay. And all of that. And I encourage families by just saying, we learn new things. We learn better ways to do things and safer ways to do things. And frequently I compare it to a car seat, scenario. Like I remember not being in a car seat myself. But there's very few families right now that would just put a baby on the front seat and go to the grocery store. So we learned it's unsafe and we have to do better. And that's kind of where we are with the sleep scenario as well. So anatomically for a baby, this is interesting. I think sometimes you have to explain the why, not just the what. You have your food pipe and your windpipe. You have esophagus and a trachea. The way that your anatomy is designed, you are able to clear your airway when you're on your back. Babies have that gag reflex. They are able to clear their airway. When they're on their bellies, that suffocation, it actually makes it easier for any fluids that are coming up to get down in that windpipe when they're on their belly, just because of the anatomy of those two structures in their body. So the other thing that grandparents say though is, what about a flat head? If they're on their back, they're going to have a flat head all the time, which is true because the bones in the head don't fuse immediately after delivery. So usually we say two things. One is that you're going to hold your baby and carry them and love them and not just leave them on their back all day long. So that helps round out their head. But having that tummy time is super important as well. So tummy time is just most parents take a blanket and they lay it on the floor, put your baby on their belly and allow them some opportunities to try and flex that neck. It builds strength in the neck muscles, the shoulders, even the front of the neck, which helps with vocal cords and speech and those sort of things too. So tummy time just needs to be supervised always. So if your baby's on their belly and you have to let the dog out, you need to turn them over, put them on their back because they're just unable to control that head and they could get blanket, carpet, a pillow, something around there where they wouldn't be able to breathe.
Jeez. Man.
Having a baby's a lot of work, right? There's so many instructions we have to follow.
I'm thinking about a lady who delivers twins or triplets, and I can't even imagine
Right.
what that must be like.
Right.
Okay.
One is a lot.
Gosh, amazing.
Mhm.
Um, so what do you tell a mother about breastfeeding and safe sleep? Well,
So
we
this is,
talked about safe sleep, but
yes, yeah, no, it's a hot topic right now because um, when you get up for feeding, a lot of times we don't get up for feeding. I think that's the key. You stay in bed and you feed your baby. And um, again, back to the co-sleeping, there's just this, there's a group of people that sometimes think that's okay and it's safe, but I get just the fatigue of parents. And aside from that, you're just in that space, so tired, feeding your baby. It is very common to just doze off. So what we try to say, I learned a new way to word it last night, but what they're calling it a safe zone. So if you're feeding your baby in your bed, just remove your pillows and pull your blankets back so that if for some reason you do fall asleep accidentally while you're feeding, none of those things are in the area. Also safer actually to do that in your bed than a sofa or a recliner, because those, just the design of that allows for a baby to be wedged, and not have airway breathing. So we encourage anyone who is able to breastfeed to do so. It significantly reduces the risk of these things like SIDS and those sorts of things. It's great. So if you're able to breastfeed, then we encourage you to do it, but just do it safely and make sure that you are um, getting some help too. Another thing you can do is ask your support person, can you make sure I'm awake? Give me 10 minutes and give me a little nudge and make sure I'm awake. Or even set an alarm, on your phone. Give yourself 10 minutes of feeding time. And if you feel like you're dozing off, then the alarm will go off and wake you up so you can put your baby back in their safe environment.
okay, car seat safety is very important.
Mhm.
How do you know if your seat is properly installed?
Well, you don't sometimes. They have gotten so advanced and safe and
Yeah.
complicated that it's really hard to know. So interestingly, Stark County, the health department does some studies on this, and they have found that about 65% of car seats are used improperly. And when they did interviews, they had found that 3 out of 4 families who were just adamant that they had done everything right and were like, no, we got it. It's in there just right. And in fact, were not properly installed. So the good news is there is a Safe Kids program through Stark County Health Department, and most of your local fire departments will do an inspection for you with an appointment. Either installation, if you haven't installed it yet, they'll help you with that, or if you have installed it, they will inspect it and make sure that it is all safe and ready to go.
There's been lots of changes lately in the car seats, and
Mhm.
I noticed we had one in one of our stores that was like a demo. It wasn't for sale, but they came down comes a message that this particular car seat is not safe anymore. So
Mhm. Mhm.
we had to throw it away, so we didn't get it in the hands of somebody else, So
Mhm. Mhm. They're very, I mean, all the advances have been great. They make them so solid, and they have these straps now, tether straps that, secure it in there nicely, but um, it's important to use them properly. Things only work. We kind of mentioned this with our computers. They only work when we properly use them. So the safety of that is vital.
okay, final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show. We are talking with Christine Powell, RN from Aultman Birth Center. So, one more question about the seat,
Mhm.
car seat. How long does a child stay in a car seat?
So they need to stay in a car seat for a long time, actually. So we start off, you transition. So you should always follow your instructions on your car seat, your manufacturer's instructions, all of that. But your infant seat, you go from your infant seat to your toddler seat to a booster. So you stay in that toddler seat until they're about 4 years old, 40 pounds. Those are the regulations there.
Hmm.
Then when you get to that booster seat, it goes to 8 years old or 4'9" tall. Your infant seat will be based on weight, how heavy your baby is and how long they are. And the current recommendation is 2 years rear facing for a child in their seat. So it seems like a long time. And again, that one's kind of based on growth. So if your baby is in their infant seat and you're looking in the rearview mirror and you kind of see their feet wrapping up the back seat, it's time to turn them forward facing. But if they fit in that seat nicely, then they should stay rear facing as long as possible. And then that booster seat, the booster seats now, most kids love those because they have the cup holder, they've got all their stuff, pockets that they can put all their goodies in and all of that. So most kids are okay being in that booster seat until they're about 8 years old.
Safety word here, car seats and cars and, in the grocery stores, in the parking lot. It's kind of frequent that I see a baby in the car alone. And with this kind of weather we're having, and maybe there's a little crack in the window, but I'm thinking, my God, how awful. And the other thing that our Canton store is on Tuscarawas Street, okay? And there's sidewalks on both sides of the street. And I do see ladies and men in a bushy thing, and they don't have any sunglasses on. And the sun is just bright as you know what. And I just want to stop my car and get out and say, hey, here's a pair of sunglasses. but I just are women with babies cautioned about this kind of thing?
I can't say that we do any education about sun and eye. I'm going to say that probably as you visit your pediatrician, as your babies get bigger and you're doing those things, being out and about, then perhaps they discuss that. I would like to think they discuss that. We kind of, in the hospital, at least in where I am currently in the birth center, we are kind of addressing what's at hand right now. And then hoping that the follow through is when you keep your consistent pediatrician appointments for all of your follow up. But it's funny when you say you want to say something because it's a job hazard when you're out. I find that my thing is there's pacifier holders that have stuffed animals on them. They're adorable, super cute, and I think, why are we putting a stuffed animal right in front of your breathing space when this is something? And my daughter will say, Mom, don't say anything. I'm like, I have to. I can't. It's my obligation. I am committed. I have to say something, like, just make sure that's not in their crib, And she's like, oh, you just can't not say anything. I said, no, I cannot. It's safety. It's important.
Well, in the spirit of safety, how would you like to summarize infant safety to families and caregivers that are listening today?
So I know we kind of talked about a few things that maybe weren't so great to hear, but I think just wrapping it all up, first and foremost, taking care of yourself before you get pregnant, and then as you are pregnant, keeping those regular doctor's visits, listening to the advice and the care and treatment plans that your physicians or your practitioners, whoever you're seeing, is providing for you. And then once your babies are here, just doing your best that you can. That's all we can ever do, is just the best that you can. But when that gets tough, and when you feel like your best just isn't enough, it's okay to ask for help. And you have to ask for help. And so, we hope that everyone has family, support system, friends. But if you don't, that's what your pediatricians are for. That's what your care providers are for. In the extreme cases, your hotlines, your emergency room. I mean, there's no one, if you come in with a baby that's been crying for hours and you're just at the end of your rope, nobody's going to say, why'd you come in? We know where you're at. So don't ever feel like you can't ask for help. You need to lean on people. There's a reason we say it takes a village, right? To raise a child. And like you mentioned earlier, I think there's this, we have to be tough, everybody, and you want to be a great mom and you want to be a great parent. And that doesn't mean you have superhuman powers. Everybody has a point where they need some help. And it's okay to ask for that and seek that. And then once your babies are here, like I said, following up with your pediatrician, keeping those appointments, and, recognizing signs of illness or, things like that. It's always better to call ahead than it is to try and catch up after if something has already progressed a little too far. Don't ignore that fever for hours and hours at a time. Then we get into dangerous situations that way. But truly, that all being said, it's one of the most amazing experiences you'll ever have in your life, and it's a privilege and a joy to be a parent, even through all those hard things that we talked about. And remember, those are temporary. When you have that fussy new baby and you haven't slept for a while, that's temporary. Eventually, they're going to be at school and you're going to miss them. And then they're going to be teenagers and you're going to kind of not miss them again. And just then it comes back around. You have adult children that are lovely, and it's a journey. But give yourself some grace and don't be afraid to ask for help. And
I'm curious, how many babies have you seen in your career?
oh my gosh, now you're asking for math. So well, I'm just gonna estimate here. We deliver about 2,500 babies a year.
Oh gosh.
So I'm not gonna pull my calculator out, but 30 years, and
Oh yeah.
it's a lot.
Wow.
So
Holy cow, that's about 75,000, isn't it, or something like that?
thanks for the math help.
Gosh. Holy cow.
And I wouldn't want to do anything else. I don't, in teaching, even teaching childbirth, like when we're explaining just pregnancy anatomy, and it still kind of stops me. I'm like, wow, it's so amazing what your body can do, and and what a new baby is like. And I mean, I'm happy about that. I feel like a lot of people get burnt out and tired, and I'm very grateful that has not happened to me. It's still pretty awesome.
Wow.
Well, that's wonderful. Can you tell the listeners how they can get in contact with the Family Education Outreach Department at Aultman?
Sure. So my direct number is actually, I'll just give you the website because it's all on there. But you can visit us on our main hospital page at aultman.org. And then there's a services tab, and we are under Birth Center. Is the department there, and all of that breaks it down into family education, all the other topics there, and my number is on that homepage. So yeah, anytime.
Excellent.
Okay.
I think we're about at the end of the show, are we not, Brad?
Yeah, we're about out of time. Maybe I'll slide one other comment in there. You commented on how important it is to keep your pediatrician visits with a newborn. Maybe it's a good idea too, if you don't already have a primary care physician as a mother-to-be, you find yourself one, and then have a discussion with that healthcare provider before you get pregnant to prepare for, much like you said, to set yourself up for success. So we have an awful lot of patients we see at the medicine center that come in that don't have a primary care physician. And there are a lot of resources on Aultman's website that you can go and find doctors who are accepting new patients. So take advantage of those resources too.
Yes, for sure.
Okay. Well, thank you very much, Christine, for helping us out here today. Babies are not our department. But anyway.
I've got you. I've got that department. Thank you for having me.
Okay, so Christine Powell, BSN RN with Aultman Birth Center. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC. Thank you very much, Christine. It was very interesting.
Thank you.
Thank you.
Amazing the number of babies you've seen. Just amazing.
It's pretty good. Good stuff. So.
Have a good day.
Thank you so much.
Thank you very much.
Thank you.